Hi, I'm Nancy Morgan, co-founder of the Wound Care Education Institute, and today I'm with Tom Miller. He is the Director of Marketing Development for Silverlon. Thanks for being here, Tom.
Well, thanks for having me, Nancy. I appreciate you giving me the moment.
Well, absolutely. Could you just start, if you don't mind, just kind of like tell me and explain to me the whole silver buzz? Seems like every time I'm turning around, I'm hearing something about silver in wound care.
Silver and its antimicrobial properties in wound care makes a lot of sense.
Yeah.
Silver, the beauty of silver is the silver ion. It kills all bacteria known to man. There is no resistance to it, and very little silver ion kills a lot of bacteria. Most wounds that are draining heavy are in the inflammatory stage, basically have a bioburden. So silver makes sense combining it with products to help treat the bacterial load of a wound.
Okay. Is this an example of one?
This is Silverlon, our wound contact dressing. As you can see, it's a cloth plated with pure metallic silver.
Nice. I mean, it's kind of like very stretchy and easy to contour to the wound bed.
It was meant to be user-friendly and comfortable for the patient. So it conforms to a wound, right? It's gentle to the touch, and the surface of the dressing is covered with pure metallic silver. The nice feature about that is the silver ion originates from the surface of the metal. So by having the metallic silver surface on the dressing, we have a continual release of ions and a replenishment. You can look at it almost as a reservoir of silver ions.
So it's non-stop silver pretty much, right?
That's correct.
How long can I keep that in a wound?
It's used regularly for 7 to 10 days. It can be taken out daily and rinsed. If, say, let's say you had a heavy exudating wound and you covered it with absorbent dressing. Now, when the absorbent dressing fulfills its functionality and it's saturated, you can take this off, rinse it in the sink with regular water.
Regular water?
And put it back in. Yes.
Oh, so you don't need any special solution or anything with this
No,
product?
this one can be wet and rinsed with either regular water, sterile water, or saline.
Okay, well, great. Now, I noticed that there's different shapes. Are each one kind of do the same thing, or?
Argenta Medical manufactures Silverlon. We're in 3 marketplaces: wound care, which you're involved with. Yes.
Yeah. Yeah.
We're in burn care, and we're also in surgery. One of the other products that we make are post-surgical dressings. It has the same silver surface, metallic silver plated to nylon, in a rectangular form because incisions are straight. A doctor would wet this with water to activate it. That's how the ions are free and liberated, so they can move into the suture line. And then all he does is he puts it on. So we can, if it's a arm, chest, belly.
Nice.
It's a nice product. A patient will wear this 7-10 days, and this is waterproof tape, so they can go home and take a shower.
Oh, good.
The other product that I think is one of our fastest growing, and there's a true need for it, is our Silverlon negative pressure dressing. This one, we put flow ports in, so the fluids pass through it into the medium for the filler.
That's what those holes are?
That's what they are.
Oh,
this is
okay.
a special knitted product for us. It has a metallic silver surface with flow ports to allow the fluids to pass into the negative pressure wound therapy canister.
Oh, that would make sense.
This also can go into the wound, and we can go now 5 to 7 days between changing out the kit. Saves a nurse a lot of time and a patient a lot of discomfort.
Yeah.
It's a wonderful little product for us, and people are enjoying using it.
Okay, great.
The other category of product, it happens to fall in wound care, is we take our same metallic silver nylon and we needle punch calcium alginate through it. Now, for your heavy to moderate draining wounds, this is a wonderful product. The good news about this is because we have our metallic silver nylon in the core, it doesn't fall apart. So if you were to put this into a draining, tunneling wound, instead of having to flush it out, which you mostly have to do with the other products, this one, you get a forceps of your fingers, it's not going to tear. The nylon, like pantyhose, is going to hold the integrity of the product.
Oh, so I won't lose it.
You won't lose it, and it comes out with the exudate instead of having to flush it out.
Well, that's nice.
Yes, it's a nice little product for us. And the only other dressing in the category of a wound packing, it's the same metallic silver nylon, right? So it doesn't tear, it doesn't break. You can put this into undermining wounds.
Oh.
And it always comes out. But now what this does is actually puts the metallic silver into the tunnel where the bacteria more than likely is residing. The two other products, again along wound care,
Okay.
one is our simple little adhesive bandage that has a 1-inch square of the metallic silver on a blood pad in a bandage form. This is really nice for, let's say, nursing homes. It's an inexpensive product that they can use for 7 to 10 days on MRSA. So most MRSA infections start with a little redness,
Yes.
and they really don't know what to do with it or treat it. So in this case, they can put a little adhesive strip on and leave it. It has soft or light tack, so we don't have to worry about skin tears on seniors.
Can I try that?
Oh, absolutely. Use it no different than any other bandage. You put it on,
Nice.
comfortable to wear, and
Yeah.
it actually has the functionality of being antimicrobial. And a lot of folks will comment on how this actually will take the pain out of a wound.
Nice. Beautiful.
And recently, we launched our little IV catheter dressing for antimicrobial barrier for your PICC lines, etc. We've done quite a few studies here, and it's lowering the infection rate. And it also used for 7 to 10 days. Silver side down, your film dressing over, you're done.
7
7 days.
right?
Well,
or longer. 7 to 10.
At Vanderbilt in the NICU, we actually are using a smaller version of this for up to 30 days.
Oh, beautiful.
The nurses really don't have time to change the dressings every 7 days, so by allowing this to stay on for up to 30 days, they're having no skin reactions and no infection. So it saves the nurses time to do what they really need to do for these very fragile little children. We have a website, silverlon.com. There you'll see all of our clinical data, all of our product assortment, and there's also a place that you can buy direct. We sell a lot of product to the general public because all of our products have over-the-counter approval. They're safe and effective, and they're easy to use.
Well, thank you very much.
You're welcome.
For coming out and showing me all these different shapes and sizes and stuff. This is great. I think that we can really make an impact with the wounds.
Perfect. Thank
All
you.
right.